Hi, my name is Melissa Moore, and I'm going to be presenting my community health project. It's focused in Collinsville, Texas, and my aim is to promote chronic disease prevention and promote health education in this rural population. So Collinsville, Texas is within Grayson County. It's a very small rural town, and it has only about 1,700 people in it. Has a very rich history. It was established in the mid 1800s, and it's got a very strong local value, close-knit community, schools and churches within that community. It has a residential area around the town center. There is a small subdivision area, but there's a lot of agricultural area all around that town as well. And there is a lot of residents that is their way of living is through agriculture. So they have pretty limited healthcare infrastructure. They have to go to Whitesboro or Sherman or Gainesville to be able to access healthcare and to be able to access a lot of grocery stores as well. They have a Dollar General there, but as far as groceries go, if they're not necessarily having a garden in their home, they don't have a whole lot of access to fresh fruits and vegetables in that area. The main health issues in Collinsville includes diabetes, hypertension, and obesity. They have very limited access to primary care and preventative services, like I discussed. Many residents are uninsured or underinsured, which creates a problem. So not only is healthcare far away, but they don't even have insurance to cover it. The leading causes of death in Grayson County, according to the Texas Department of State Health Services and the CDC, include heart disease, cancer, and stroke. It is a very rural area and it has a moderate poverty rate. And like I discussed earlier, they have fairly limited transportation. There really is no true public transportation in the area. They rely on themselves or the community helping them out if they have to go somewhere, or they just don't go. Strengths and needs within the community is a very strong community. They have very strong engagement. There are a lot of local businesses that are always willing to support the schools and the community. And the local organizations between the schools and the churches are always willing to collaborate. There's a lot of volunteers. It is a very strong, close-knit community, like I've said several times so far. Seeing them band together for members within the community is really neat that I have actually witnessed in the past. Needs include improved health literacy, though. They need better access to chronic disease education and preventative care. And then they need accessible, culturally appropriate healthcare resources as well. So it is predominantly white, but there is a very significant Spanish-speaking population there as well. And we need to make sure that we're culturally appropriate with them and that they're getting the resources that they need as well in their language. So, based on the identified health issues and community needs, nursing diagnosis would be risk of chronic illness complications, especially among older adults, low-income families, and youth related to limited access to healthcare services. There is low health literacy and inadequate preventative care, as evidenced by high rates of obesity, diabetes, and hypertension within that region. So I have three main goals with my project. First one is going to be to raise awareness on chronic disease prevention, let them know, what chronic diseases entail and how to prevent it and how to access resources for that as well. I'm going to give them practical tools for healthy living, ways to make meals on a budget, Um, Especially because, like I said, they are very limited in their access to grocery stores. So things that they can do on a budget and that they may already have within their home already. Something that's easy for them to cook and easy to obtain at the local grocery stores that can be limited. And then also simple physical activities that they can do at home. So they don't need a fancy gym. There is no local gym there as well. Some people have them within their houses, but there's plenty of ways that they can do things at home using their own body weight and using simple objects around the house. For weight, added weight as well, that they can do and be safe and then still be moving their bodies. And then my third goal is to give them, have them take charge and feel equipped with the knowledge and resources to engage in their self-care and their wellness. I want them to feel like they know what resources that they can access. Whenever you live in a rural community like that, it can be easy to kind of feel like you're in a bubble and not necessarily know what is outside of that bubble. So them knowing what resources there are just a little bit outside of their community and how to access it and how to access it even just online would be a big help to this community. Simple first aid is also something that we want to teach them. And then CPR is also very important because if somebody has cardiac arrest out there, it's going to take a while for an ambulance to get out there to them. And they actually had an incident like this where there was an emergency and the local fire department came through and it all had a great outcome because of how strong this community is and then being prepared. It all had a great outcome, but making sure that as many citizens as possible know basic CPR and first aid is really important. And then mental health and stress management. So ways to identify stress and anxiety, and then giving them the tools to be able to help reduce stress and know what resources that they can access for that as well is going to be important. So evidence-based support. So community-based health education programs reduce chronic disease risk. Rural interventions improve outcomes when they're culturally tailored and delivered through trusted local organizations. Like I said, it's a small, close-knit community. So whenever it's somebody that's trusted to them, they're more likely to take that to heart and actually use it. And then these efforts are going to align with the Healthy People 2030 objectives, focused on diabetes prevention, obesity reduction, and increasing health literacy. My potential funding sources include Grayson County Health Department. The Health Resources and Services Administration gives rural health grants specifically to rural communities. And then the Texas Department of State Health Services. We have local businesses and churches. Like I said, it's a very strong community. They love to support members of the community. And so whether it's monetary or even just volunteers, they can help us just with resources in general, helping with reaching the community, helping with these days that we're educating the public, just more hands on deck. It doesn't always have to be funding. So I'm going to implement this plan over the course of a year. And the very first phase is going to be community outreach. And that's going to be through months 1 through 3. That's where we're going to partner with local organizations. We're going to promote through flyers, social media, and school newsletters. Phase 2 is going to be the delivery of the workshops, and that's going to be through months 4 through 10. We're going to have bi-weekly educational sessions. And we're going to rotate venues between schools, churches, library. There is a community center as well. And then as far as being able to provide transportation, we'll see if there's any opportunities to provide like a public transportation, or if there's members in the community that are interested but unable to come out, if we can go to their houses and do some education within the house and provide them with some written materials to help them. Phase 3 is going to be my evaluation phase in the last 2 months. And we're going to evaluate through surveys, forms, and observation. Barriers, like I said, there is limited transportation. And then there's language literacy issues. Like I said, there is a Spanish-speaking population there. There is obviously the lack of healthcare access. But the resources that we're going to use, community healthcare workers, bilingual educators. To overcome the lack of healthcare access, we could provide them resources for telehealth as well. We can use written materials, print them out from CDC and Rural Health Info Hub materials. Cultural considerations, we're going to provide materials in English and Spanish, obviously. And we're going to provide a very family-centered learning approach. There's a very strong family-centered community. So we're going to make sure that we include, elderly, but also just the entire family as well. And then we're going to have respect for the rural values and traditions. Living in a rural area, people choose to live this way. Some people live, like that is their dream, is to be able to live in a rural area and have a very small, tight-knit community. And it has a lot of pros. And so they shouldn't be limited just because of where they want to live. We want to make sure that they have equal access to healthcare. And so we want to make sure that we're not necessarily talking down to them and they feel supported. So my teaching points are going to focus on how to manage chronic diseases with small lifestyle changes. We're going to have cooking demonstrations with affordable ingredients. Like I said, home-based exercise routines, basic emergency response and CPR first aid, and then recognizing and managing mental health symptoms, so signs of stress and anxiety, and then offering them tips on mental well-being. To evaluate this and ensure success, I'm going to conduct a summative evaluation. So it's going to be through pre and post surveys to assess changes in knowledge and behavior. We're going to track the attendance and the engagement rates. I'm going to collect testimonials and qualitative feedback, and that's going to help me understand the impact and how the community perceived these workshops as well. And this is going to be really important for the future programming. These are the references that I used. Thank you all for your time today.